I just want to summarize a couple of things really, really quickly because there were some very important points that the parents made. One is do your homework. Make sure that you uh, talk to a number of different individuals. If you live far away from a large urban center, that you spend the time and make the effort to ensure that you are discussing the condition with someone who is very experienced and knowledgeable. Secondly, it is exceedingly important that anyone who is considering having a Nuss procedure done undergo comprehensive testing, just as it was described by the parents during this roundtable. The testing is not discretionary. It is an absolute necessity. The information that a patient and family will receive, having gone through the testing, is absolutely necessary to know how the individual is being affected by the condition. So an MRI is generally what is used for the purpose of doing the measurement of the deformity. It avoids radiation, and it also allows you to combine the measurement of the deformity with an appreciation for how that degree of severity is affecting the circulation between the heart and lungs. So an MRI of the chest and of the heart is exceedingly important. Seeing a cardiologist, seeing a pulmonologist, having an echocardiogram, an EKG, and pulmonary function testing, absolutely mandatory. A stress test, as one of the parents mentioned, not a stress test to see if your coronary arteries are clogged, but rather a stress test to determine whether or not you are physiologically performing at a level consistent with your gender and age. So that's a VO2 test or a metabolic stress test. And that's, again, really important because it combines knowing how deep the deformity is with knowing how that degree of severity is affecting cardiopulmonary circulation. So again, a very, very important data point that everyone should have. And then lastly, allergy testing to make absolutely certain that your son or daughter does not have an allergy to stainless steel. And if they do, then a titanium bar is indicated. Next thing I think that was so well presented is deeply questioning anyone who you are considering with regards to their pain management strategy. Everyone's strategy should be slightly different because patient's pain and pain reception is different from patient to patient, but the overall outline of the approach to pain should be consistent with how this is done at centers of excellence. So going into detail with a provider with regards to pain management is exceedingly important. And anyone who is doing this at a high level of proficiency should also have a pain service at their disposal so that if an individual is not responding as they should, that corrective steps can be made in concert with a pain specialist and pain team in order to optimize the pain management at any given time during the continuum of care. It's super important to understand that the perception of pain after a Nuss procedure is very individualized. And so the treatment has to be very, very individualized. I personally use intercostal nerve block, and I use a long-acting local anesthetic called Exparel, which is a liposomal bupivacaine. It lasts for 3 to 4 days. As many of the families mentioned, there's a point of transition when the block wears off and additional pain management needs to be arrived at in order to continue to manage the patient's discomfort at a point 3 to 4 days removed from the surgery. And then that pain management needs to be adjusted as you get further and further away from the hospital stay. So there's a continuum of pain management that is necessary, and how that is going to be arrived at. You as the family members and the patients themselves need to be comfortable with what that strategy is going to be, understand it fully, and trust in it. That's important. You have to trust that the person who is providing that care is doing so according to the standards of care that exists for centers of excellence doing this work. And that brings me to the last point, which is this is a very specialized area of chest surgery. Chest wall surgery is not done by all thoracic surgeons. So be very, very careful when you're doing your due diligence to make certain that you know that the individual who you're dealing with has done multiples of Nuss procedures, hopefully over a wide range of severities and over a wide range of ages. When you start to do your research, make certain that experience exists in anyone who you would consider as a potential provider of this very unique care. So I think those points were well made by the families. I just wanted to emphasize them, and we'll open it up for questions.
Hi, everyone. As I put into the chat, you're welcome to ask a question via the chat. We'll come, first serve. However, if you would prefer to ask questions in open dialogue, you can raise your hand and I'll call on you and you can unmute yourself and you can ask any of the parents or Dr. LoSasso in order. So for our first question, if you have any questions about raising your hand, here's a screen that will tell you how to do it. In a second, we'll switch back to the parents slide so that you can call on parents in particular if you have an insurance question, for example, etc. So the first question comes in from Maria. How is life with the bars? I know that they have to stay in for about 3 years. Are there any ongoing pain or limitations while the bars are in? More specifically, parents, did the kids complain about bars once they'd been in and recovered a couple months into the procedure? Does anybody have any input into this? Were there any limitations?
This is Will's mom, and he's had very little pain or discomfort from it. I think once we figured out sleeping, it got better. We started the first day home where he was on, I thought he was going to be in a recliner, and I thought that would be best for him. But we lasted for about 5 minutes and he said, Mom, I can't do this. So we had a wedge pillow and we went up to his room and he tried out the wedge pillow, and he's still in the wedge pillow since June. And he has not had any discomfort that he, when we first had surgery, if he had discomfort, he'd ask for Tylenol or Advil or whatever was necessary at the time. But it's been minimal, and it's been rare at this point, and we had it June 24th.
Just a quick question on that wedge pillow. Is that just something that you ordered off Amazon? Is there a specific brand you'd recommend, or just any kind of triangular shape?
We ordered one off Amazon. I'm on some Facebook support groups, and somebody had recommended one. I don't know if one is better than the other, but some people do not like the wedge pillow, and some people do. I think it's all like kind of a trial by error with your child. I know some people have bought the adjustable beds that they can get off of Amazon that I've seen. We didn't go that route because we first started with the wedge pillow, and if we needed to go on from there, we also made sure we had a recliner at home. And he did sit in that a lot during the day.
Yeah, and I think to your point, every patient's a little bit different, because we do have some that swear by the recliner and nothing else. So that's a great point. We kind of start with the smaller option and go from there.
Yeah, there's the lawn chair that people have talked about too. The one that I forget what the name of it is.
Like the zero gravity type ones.
Yes,
gotcha.
Yes, that one they've talked about too.
Good idea.
Hey Kim, this is Ryan. Quick, just one other thing to add there that I forgot to mention. We did the wedge also, and my son, it really helped him sleep at night. But the one problem he had was that he kept on rolling off of it and getting onto his side, which was pretty uncomfortable. So what we did was we took 2 beach towels and kind of rolled them up into a big cylinder and stuck them underneath the bed sheet, underneath the fitted sheet. So he was kind of, it was almost like crib bumpers, if you will, right? So it was just right up against his side, and it kind of kept him in place all night. Once we did that, he was able to sleep the whole night and didn't have any problems rolling off of the wedge pillow as well.
Good to know. Thank you.
So this is Mikey's mom. It's interesting to hear because we actually had the wedge pillow waiting for us. I borrowed it from my mother-in-law, and we thought we were going to be great with that. We would just barricade him in, like you said, with the bumpers, and we'd be good. I had the bed all made. It didn't work for us. And, he's 25. He's significantly older than all you other kids, but we had to do a trial and error thing, and he certainly couldn't lay flat. The wedge pillow was very uncomfortable for him. And I actually talked with Dr. LoSasso, and I said, how about the recliner? And I had peace of mind with the recliner because he is a side sleeper, and it really kept him kind of immobilized in that position where he could, go back a little bit farther or just a little bit up and have his feet elevated too. So it's interesting what works for one doesn't work for another.
Dr. LoSasso, if you are using titanium bars, is allergy testing still recommended?
Well, that's a good question, and I use titanium bars selectively. But the specific answer to the question is, if someone is going to use titanium, then there isn't any need for testing, because the incidence of titanium reactivity is very, very, very rare. I test for titanium sensitivity just because I'm doing the testing already, and I want to assure myself that the titanium, if there is another allergy, is not shared with titanium. But most people would not react to a titanium bar. The reason I don't use titanium as my go-to, my first choice of implant, is because I like to bend the bar myself. I like to use a hand bender to literally shape the bar to fit the patient. And I can do that with a stainless steel bar. I can't do that with a titanium bar. A titanium bar is shaped at the factory. It's shaped through a dialogue between provider and the engineering department of the Biomet Zimmer company that manufactures the bar. It's done using a MRI or CT scan, whichever the patient has. In my practice, it would be the MRI scan. And we superimpose onto the MRI a bar, and then we determine between the engineer and I what the shape of the bar should be and the length of the bar based on my measurement. So there's a collaboration that occurs. It's generally good, if not excellent. Sometimes I have to bend the ends of the bar for titanium occasionally, and you can adjust slightly the ends of the bar with that same hand bender. But the artist in me really loves using the stainless steel bar that I can personally bend. So that's the reason why I use stainless steel as my favorite. Titanium if the patient has a metal allergy.
And just a kind of quick addition to that, for the titanium bars, the stainless steel is a softer material, and it's easier to bend, but with the titanium, it creates micro fissures in the bars if you're over bending. And so with the process at the manufacturer, they would be able to bend the bar and then buff it out so that there aren't micro fissures in the bar that are going to create dangerous adhesions to the bar that you might not necessarily want within the bar. So little tweaks, like Dr. LoSasso said, absolutely acceptable, but just making those larger shapes, it just doesn't really work in the OR because there's a risk there.
Absolutely correct.
Maria asked another question, and this is maybe aimed at the parents in the very beginning. Parents, how soon did you notice a physical change of the chest and a difference in the ability to do exercise or disappearance of symptoms that were there prior to surgery and then after recovery? What were the changes? How long did they take to actually appear?
That's an excellent question.
I don't want to be the one to speak up all the time, but Will had in his 12-year physical, the doctor noticed it, the pediatrician noticed it. I had no clue about any of it, never noticed it before, and felt very uneducated about it. By the time he went into surgery, it was pretty severe. Clearly, they put him on a beta blocker when he went for his stress test, so it was affecting his heart. He's not athletic, so he was not fazed by it. It did not affect him greatly, but because we did all of the testing that was required, we knew it was affecting him internally. He feels tremendously better now. He didn't realize because this was his normal, so he didn't really have a clue that this was affecting him as much as it was because he was not athletic. But now that it's done, he's like, I can, when we go on long walks, I can go up the hill and I'm not winded and it feels fine. So for us, it was pretty soon after, like immediately after it's fixed. And then as they start walking and they start improving and they're doing more of the walking that's recommended, they notice it very quickly after surgery.
And this is Ryan Quinn. Our son, one thing that shocked us was how physically it just looked perfect after the surgery was done. The day of the surgery, I mean, I think there's a photo here somewhere on this presentation where you can see immediately before and immediately after, his chest was fixed. It was perfect right afterwards. So for whatever that's worth, physically on the bottom there, you can see, I think we just passed it there. Right there in the bottom picture, there's a bandage on there, but the top you can see it's asymmetrical and the dent is pretty severe. The middle is on the operating room table and the bottom is right afterwards. And it's just, we just couldn't believe the difference immediately. So that was the day of surgery, you see that physical difference.
This is
all right.
Sorry.
Go ahead, please.
I was just gonna say, Nick had a lot of back pain and neck pain before the surgery, and he would sometimes have, I guess he noticed he was having some trouble with exercise, just when he ran or anything like that, he would have trouble. But after the surgery, he says he has no pain at all in his back anymore or his neck, because it threw him out of alignment, and he was having issues with that, and his ribs stuck out on one side pretty dramatically. And there's changes that we've noticed. It's actually sunken in, since it was still protruding a lot after surgery, but we noticed that is gone. It's actually kind of going in a little bit, and I didn't know if we expected that to happen, but he's feeling really good. And I think I mentioned it earlier, but he had he saw his asthma doctor, and they said he had 1 liter more of oxygen, and that was like last month. So it was after 4 months after the surgery. He had that much more air in his lungs, which is great.
So let me just outline the continuum of recovery, because that was really the gist of the question. So you should expect to go in to the operating room with a sunken chest and come out with a corrected chest. I mean, the effect that the bars have on the chest wall is immediate. It happens in the time it takes to take the bar from this configuration to that configuration, right? With a flip of the bar, the chest comes forward. So that should be your expectation, that the chest will be corrected and that the sunkenness should be, if not completely, then near completely resolved. The next issue is, well, when will I start to feel better? When will some of my symptoms of shortness of breath and exercise intolerance or lack of stamina start to subside? That varies from patient to patient. But what I tell patients is, by the end of their physical therapy, which is 3 months, they should be back to a level of conditioning that, if they are athletes, if they do participate in organized sports, that they can go back to training for that sport at the end of that 3-month interval of physical therapy. Most high-functioning athletes have told me, have shared with me, that it's somewhere between 9 and 12 months that they really start to feel the full effects of the operation in terms of their athletic performance. So being able to run farther, have more stamina, compete more vigorously later into whatever the game is that they participate in. That generally happens somewhere between 9 and 12 months. I allow my athletes who participate in organized contact sports to go back to actual competition, if all goes well, at 6 months post-op. So that hopefully gives you a sense of what that continuum of recovery should look like. But again, every kid is different, and each person goes through their own personal journey with regards to the timing of their recovery. So that's why I try to keep things very, very general in terms of what individuals can expect. But I think that summarizes my experience in treating this condition over 20 years.
Parents, would any of you recommend renting a hospital bed? Show of hands, discussion, wedge pillows, big cheese, hospital beds for the first few days at home, recliners?
I didn't
Ryan,
think
go ahead.
the hospital bed was necessary. We did get one of those electric recliners. We got it from a Facebook site that gives away free stuff. I think my son used that maybe once or twice. So from our point of view, I wouldn't go the route of the hospital bed, but again, everybody is different. So kind of your own personal opinion there, I think.
We bought a electric recliner, and we had bought it well prior to the surgery, but in the back of my mind, I knew surgery was coming. So there was a store going out of business. So that's why we bought one. And he used it a lot at the beginning when he was awake during the day. He didn't like it, as I said earlier, when he was sleeping. I also think that having ice packs, we had a good ice pack that had like a Velcro that could like strap around his chest. That was super helpful, along with a heating pad. Right at the beginning, like having anything like that handy that you don't have to like order, but I made sure I had it all there. Having the Tylenol at the right strength and the Advil at the right strength so you don't have to run out for it was really helpful for me. And that's what I've recommended to any parents who have reached out to me from the Facebook groups. Is these are the things that were really helpful at the beginning.
All right, so we do have a video of a webinar that specifically discusses physical therapy after recovery on our website. But Dr. LoSasso and the parents, did any of you do physical therapy prior to surgery to improve your child's core strength?
So again, Ryan Quinn here. My son had a trip planned about a week before the surgery. He's a Boy Scout, and he went to the Northern Tier, which is a 9-day through the backwoods of Minnesota lakes, where he was carrying about 35 to 50 pounds of weight. And he only weighs about 105 pounds. So he was training for about 3 or 4 months beforehand, just kind of building up the tolerance to carrying the weighted backpack. He was in the best shape of his life at the age of 14, the day of surgery. So I think that only helped him to recover, because he was up walking around very quickly right after.
We did not do pre-surgery physical therapy. He was just walking a lot.
Yeah, we didn't either. Nick didn't do anything special, any more than he normally did, but he didn't have any major problems. I don't know if it would have helped or not. I think he did fine. We were just very lucky.
I think anything that increases your aerobic, conditioning and capacity is helpful preoperatively. I also think that doing things like stretching and yoga, Pilates, those kinds of disciplines that involve both core strength and flexibility are things that I suggest when patients ask me, are there some things that they can do before the surgery to make their post-operative course a little easier. So those would be my recommendations. I don't think that they're an absolute necessity, but I do think going into the operation with some degree of aerobic fitness, which you can achieve by just, walking and walking vigorously, is, I think, very helpful in preparing you for the ordeal of recovery.
Parents, how long was it between your first serious consultation with a surgeon you wanted to go with, whether it was Dr. LoSasso or someone else, before the actual procedure? What is the sort of timeline for you guys?
I couldn't believe, this is Mikey's mom. I couldn't believe from the time I talked to you, Kim, I was talking to Allison within days. And then I think a month out, we were actually meeting with Dr. LoSasso. So it was unbelievable. We started late summer and Mikey's surgery was September 9th.
Yeah, we were thinking about doing this surgery, having the surgery performed in December, but because of COVID and concerns about COVID, we waited until Nick was out of school in May. So that was another 6 months, and we probably were getting 2 months into it. So I think the total journey from first visit in the office to the surgery might have been about 8 months.
We started interviewing surgeons when Bennett was 12 and a half, so a couple of years ago. I think that was December of 19, and his Howard index wasn't severe enough at that time to get the insurance approval. So we waited some time, saw the second surgeon, a different surgeon for a second opinion a year later, and saw Dr. LoSasso. I think we started talking to his office at the end of May of 2021 and had the surgery in August of 2021. So once we decided that it was time to go, it was just a couple of months.
And we met with them in the fall, and just for a personal choice, we didn't do it until June the following year.
Thanks, guys. Allison or Kim, do you want to address the testing that we're offering currently, that you can get it done in 3 days if you come to New Jersey? And then that way, Dr. LoSasso kind of addressed the fact that some people test for different things. A couple of parents said they had testing done, but it wasn't complete enough. If parents want to address that as well, a little bit more about testing.
Go ahead.
Sorry.
I was just going to defer to you on that. So.
Oh, okay. We really, because everything happened so quickly for us, I was just on a mission to get everything done before we had our meeting with Dr. LoSasso. And in doing that, even though we specified that we needed that VO2 stress test, and it was actually written on the order, it wasn't done that way. So we had hit a couple of roadblocks. And then as far as the allergies testing, I had called the allergist and I said, oh, we need this test. It's a really special test. Let me fax over the order. Well, we had to wait like a month just to get into our local allergist. And then when we got there, they didn't even have the patch. So then we were pushed out again. They had to order the patch, and just all that running around, it just would have been a lot easier and more complete if you just take the 3 days, go down to New Jersey, get the patch put on, and in the meantime, do all the other testing, see the cardiologist, see the ophthalmologist, and just do all that testing. And that way, you know that you're getting exactly what Dr. LoSasso needs to proceed, and he's got access because he's got this whole team formulated, and everything is done thoroughly and completely and accurately. And if I had to do it again, I would say, we're going to go down there for a few days and just get it done right, instead of scrambling and trying to get everything done in the hopes that it is done correctly.
Hi guys, this is Allison. So I just wanted to talk about the testing in New Jersey really quickly. So once you guys come into the office, whether it's telemed or in person, then once you're established as a patient, then we move forward with putting out the referrals to the respective specialists within our immediate area. And if you guys choose to go do the testing in your home state, that's perfectly fine. And sometimes I do talk to your neighborhood cardiologist or radiologist about how to do testing properly in order to ensure that you guys don't have to do any repetitive testing. As for coming to New Jersey, we give you the contact information for all the specialists. If you guys have plans on when you guys are coming to New Jersey, then you guys can schedule the testing according to whatever your schedule allows. But sometimes if patients or if parents feel a little overwhelmed by that process, but sometimes if you guys give us like a week window in which you may be coming to New Jersey, then we can definitely arrange for the testing to be done in that 3 to 4 days that you may be in New Jersey. And then if there's any tweaking of that process when we book your actual appointments in New Jersey, then most parents feel very comfortable with like adjusting times and the travel arrangements surrounding that. So that all logistically can be arranged within the office. But again, if there's any issues about traveling to New Jersey, then again, I'm always happy to talk to any of your clinicians within your home state in order to ensure that all the testing is done appropriately, correctly, and in a timely fashion if there's a deadline that we're trying to meet.
Thanks, Allison. Any other parents, anybody else on the line that has questions or comments that we did not cover?
I think there was another one about the time. If you see Maria's question in the chat, Kate.
Okay, so yes. For those of you, how long before your sons or daughters were able to sleep on their stomachs? When parents talk about the wedge pillow and the recliner, I'm not sure what time period they're talking about. So how far after recovery? Are we talking a week? Are we talking 3 weeks? Are we talking 2 to 3 days? Parents?
My son had his surgery June 24th. He's still using the wedge and he's still sleeping on his back. He was a side sleeper.
Yeah, we're about 9.5 weeks out of surgery now, and he's not using the wedge pillow anymore. He's sleeping on his back, but he was a side sleeper also, but he's not able to get there yet.
And we're about 7 weeks post-op, and he has actually found himself on his side sometimes because he's always been a side sleeper. But when he wakes up, he's like, oh. So he has made himself the barricades so to keep him from rolling over. But yeah, he's still not comfortable, and he's never been a belly sleeper, so I can't really address that one.
And Nick's the same. He's still sleeping on his back, and he still uses his wedge pillow, and he doesn't say he doesn't feel comfortable on his side really, and he never was a stomach sleeper, so that didn't apply.
Great question. Thanks, parents. Great answers. Dr. LoSasso, any thoughts?
Yeah, I mean, I think that it really depends on the individual, but just as a purely sort of medical consideration, I try to discourage side sleeping for the first 3 months. I just think that it tends to create some forces and some stresses to the chest wall that lead to discomfort that can be avoided by just not sleeping on your side. But usually somewhere between 3 and 6 months, that's when people tend to just find themselves on their side in the morning or at some point during the night, and there aren't significant consequences as a result of that. But for the first 3 months, I just think it's best to, even though it's difficult, especially if you're a preferred side sleeper, it's better to sleep on your back and to avoid putting the full weight of your body on the implant, which is just under the skin, attached to the side of your chest wall. And I think what happens, just if I can get back to the biology of things, is that a capsule, which is scar tissue, connective tissue, forms around the implant, and that not only anchors the bar in place, but it also serves as padding around the bar to buffer the pressure that sleeping on your side causes. So I think the biology follows the patient's ability to eventually sleep on the side, and in my experience, it's somewhere between 3 and 6 months.
Great, thanks, Dr. LoSasso. Anybody else have any questions?
There is a tremendous amount of collaboration that sometimes, not always, but sometimes is necessary between families and our office in providing information and working through the process of getting prior approval for these procedures. Different insurance companies handle this in different ways. And I just want everyone out there to know that a denial does not necessarily mean that the operation won't be ultimately approved. It just means that more work and effort needs to be done in order to gain that approval. And Ryan was just tireless in pursuing constructive avenues within his company, as I was trying to work with the insurance company to get the final approval, and we were successful. So I want to put that story out there, sort of draw a line, underline it, highlight it, because it's not that unusual or uncommon, and it does work out more often than not with some effort on the part of the provider and the family, as was the case for Bennett.
People asked, are you currently using cryo?
Yeah, thank you. Thank you for mentioning that. I am trained in the use of cryo. Our hospital is in the process of approving it. I am open to discussing cryo with any patient who feels that would be the best pain modality for them, or parents who feel that would be best for their child. It is it's not a short, it's not a question that allows a very short answer. I did an entire webinar on pain management that is available on my website. Please go to my website and review it. There is a lot of good information about intercostal nerve block versus cryoablation. And anyone who has, a lot of questions about that after reviewing the material on the website, please don't hesitate to reach out to Allison and I for further conversation.
Hi guys, I'm also putting in some links here to some of our different webinars that have come up during this discussion regarding physical therapy, regarding cryo, those sort of things. So they'll be in the chat here if you want to stay on for just a second.
And also, I think testing too, please, Kate.
Yep. Dr. LoSasso, do you want to wrap it up?
Well, yes, I would first like to thank all of the families, the parents who not only trusted me with their children, which is just an awesome, responsibility and confirmation of everything I've worked so hard to master over the course of my career doing the Nuss procedure. There's no higher compliment than a parent trusting me with the care of their child. So I want to thank you first and foremost for that vote of confidence and that trust, and also for being there for your children and doing the great job required of a parent to get a child through this operation and the immediate post-operative recovery. And then lastly, for being available to others, to give of yourselves, to give your time, and to give of the information that you have regarding your experience is just a very kind and loving act. And I want to thank you all for sharing with the community at large. It means a lot to them and of course to me. And for those of you who tuned in tonight, Thank you for your interest in the subject area. We're going to be doing more webinars, as Kim mentioned, in future months. So please stay in touch with us through my website, and we'll keep you posted on future topics. Again, all stay safe. Thank you so much for your interest, and we'll see you again next month.
I kind of touched on it before, but just to, in case I didn't state it strongly enough, my advice to anybody looking to get this done would be to, first off, don't let the first surgeon you speak to be the only surgeon you speak to. Don't go to just any thoracic surgeon. Make sure you go to a specialist. Ask the questions. Ask how many procedures your surgeon has done. If the insurance is a concern, call Dr. LoSasso's office. Speak to their billing department. I mentioned before that it was a concern for me. My mind was put at ease after I spoke to their billing department, and I don't have any regrets about the route that we went. So, and one thing I see on Facebook all the time is a lot of people get hung up on the cryo question. They seem to think that they have to have cryo, and that's a determining factor. We fully went with Dr. LoSasso's recommendation there, and we have zero regrets about not getting cryo. And the last thing I have is, when we went to, this is just kind of anecdotal, more fun, I guess. We went to Dr. LoSasso's office for the surgery in August, just to take our mind off of things. Seaside Heights is 3 hours away, 2 hours away. We took the family there for 2 days before, just to kind of clear everybody's head and have some fun before we went there. So if you have that opportunity, that was a whole lot of fun too.
All excellent suggestions, by the way. I would just say this: if you have any further questions or concerns, don't hesitate to reach out to Allison and I directly through our office. We can discuss specific questions that you may have in that format. And I would just like to say that the important thing to know, the most important thing to know, is that you are not alone in this journey, that there are other parents, other patients, and us as providers who are there to help you in any way possible to make this process go smoothly. So I would just say, please reach out. Let us help you in any way that we can. We're there to help.